Psychiatry Residency Training Program consists of 4 years in which residents are exposed to several different clinical services, including inpatient psychiatry and outpatient care, but also specialized services like addiction psychiatry, child psychiatry, geriatric psychiatry. Residents get a lot of exposure to different clinical scenarios. Memorial is a perfect blend of getting the benefits of a small program where you get to make close connections with your faculty, with your mentors, with your peers, and with patients, while at the same time providing a wide array of clinical experiences that allow for our residents to gain skill sets that may have only been able to be obtained at like tertiary level or university hospitals. So this is an excellent place to train for that purpose. We have 12 full-time psychiatrists working for Memorial, and this is outside of additional psychiatrists that also provide services here at the hospital. We had the opening of a resident-run clinic in a new building just down the street from the hospital. We also expanded our outpatient behavioral health center with multiple different services and programs under one roof to provide holistic care for our patients.
The caliber of our faculty is exceptional. I think it needs to be exceptional. When you take on a project such as developing a psychiatry residency program, it is important that you hire faculty that are going to be great at what they do, that are going to bring diverse experiences and backgrounds into the clinical work that they do, but they really have a passion for teaching.
Each of our attendings has such an incredible breadth of knowledge. Some of our attendings teach didactic lectures about personality disorders or psychopharmacology or therapy. So I'd say learn as much from each of them as possible.
The program focuses more on quality than quantity. We're a relatively small program, only 4 residents per year, so 16 residents total. It allows for us to really connect with each resident and allows for us to also personalize their own their journeys.
You're going to be supported here. You're going to have mentors and teachers in your attendings that are truly going to nurture your curiosity, your intelligence, your knowledge, and also kind of treat you like family.
I liked that it was kind of a safety net hospital where you get to see, the wide variety of patients. I think you're definitely going to be more well-rounded. Here you get to see everything.
They were really focused on wellness and camaraderie and really fostering a nice community. So Memorial was an easy choice for me.
We obviously want to make sure that we attract those who are particularly good at what they do, folks who are going to be collegial, friendly, hardworking, generally 3 different attributes that I think would make for an excellent physician regardless of specialty. 1, integrity, 2, humility, and 3, compassion. Being able to give a certain amount of yourself to the profession so that the patients that you treat benefit from that kind of commitment.
Somebody who is willing to take on a challenge and then who is also stepping beyond just the medication management and thinking about the person holistically, about what are the multiple factors that could have contributed to how the person is feeling and what brought them into the hospital. There's plenty of research opportunities here. We do encourage residents to think about scholarly inquiry and being able to not only create research, but also be able to consume that research, to understand what that research means, how to apply it to clinical situations, and translate what they're reading to the bedside.
They present posters on a regular basis at Memorial Healthcare System Research Day, at Florida Psychiatric Society. They have won awards for those posters, and they have also worked in conjunction with us in writing textbook chapters and publications. Our job as program leaders is to make sure that they develop well thought out questions so that we can then tap into the resources of the Office of Human Medical Research so they can help us with the statistics and methodology to put together projects.
I've never had an experience with attendings who are so invested really in the residents and in the learning and in the program, and so I love being here, and I think my co-residents we've already become best friends, and these are my friends for life. So it's wonderful to be here.